Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Food insecurity is on the rise among military families, and more than a third of currently serving families say they have less than $500 in savings. Those are some of the findings of the Military Family Advisory Network's biennial survey. Over the years, the survey, which is the largest independent research effort focused on the military family population, has helped shape major policy and quality of life reforms. For more on this year's survey, Federal News Network's Anastasia Obis spoke with Dr. Gabby L'Esperance, Military Family Advisory Network's Vice President of Research and Evaluation.
We do the Military Family 360 survey every 2 years at the Military Family Advisory Network. Our goal is always to understand the lived experiences of military families over the past 2 years. In this iteration, we took a really hard look at well-being and readiness, wanting to understand how military family readiness impacts force readiness. We took a broad-ranging look at everything from healthcare and food security to housing choices and invisible family load. And that instrument really gives us an in-depth look at the experiences of military families. And this year, specifically focusing in on those currently serving and enlisted families who make up more than 70% of the survey population. For those enlisted families, it's 80.4%.
What are some of the biggest findings or some of the most important takeaways from this year's survey? And then similarly, the last survey you conducted in 2023, what are some of the biggest changes that stood out to you?
I would say the biggest takeaway from the survey this year isn't a single statistic. It's the fact that the findings show how interconnected military family experiences are. None of the things a family experiences, whether that's healthcare access or food security or housing burden, exist in a silo. All of them are interconnected and paint a complex picture of military family readiness. And when we talk about the biggest takeaways, right, report really proves that military readiness starts with family readiness. Everything from increased rates of food security, increased rates of housing burden, increased rates of mental health care need, all of these things are demonstrated throughout the report and interact with one another, but really form the bedrock of force readiness as military service members rely on their families and their support systems to navigate this life. We also saw that military spouses, particularly those with children, continue to shoulder extraordinary responsibility across multiple domains. We see that in childcare. We see that in spouse unemployment rates growing. We see that for the first time this year in the Invisible Family Load Score, which showed that military spouses carry a disproportionate load in comparison to some service members. And we also saw that these military family challenges are compounding. We see a PCS every 2 to 3 years. And with that comes high out-of-pocket costs, bringing your family to a new location, having to reestablish employment for a military spouse, find new childcare for military children. All of these things compound over time.
Let's zero in on some of those issues. One of the report's key findings is that military spouses, particularly those with children, reported some of the most negative outcomes across multiple measures. What did the survey find when it comes to military spouses, and how does it compare to the 2023 survey?
If we were going to pay attention to one population in this report, I would really encourage folks to look at those military spouses. To your point, they're experiencing challenges above and beyond what we've seen in previous years. We also know that they're the folks managing the day-to-day life of military families. They're carrying an invisible load, and some of that load is just part of functioning. It's the planning, the coordinating, the work that often goes unseen as military families navigate this life. And much of that is functioning. Some of it is even rewarding and meaningful. But when we see those things compound into what is a higher invisible load score, we see some negative outcomes across family health and well-being. And that shows up across many areas of the report, right? Employment, childcare, community, family functioning, all of those things really co-locate around the military spouse and their role in the family. And so we would encourage people to really take a close look at that population and how we can best serve them. When it comes to recommending military life, we see that active duty spouses are least likely to recommend military life, about 50%. And so addressing some of these well-being needs of military spouses really is both a recruitment and a retention narrative.
One of the things that stood out to me in the mental health section, it said that military spouses were among the highest, reporting that they had suicidal ideations. Could you speak to that part?
Yeah, absolutely. So we saw across the mental health section this year some interesting data around the idea that families are more willing to seek mental health support across the board. We also saw, unfortunately, that military spouses were the most likely in their family unit to experience suicidal ideation and the most likely people in the family to go to an emergency room for mental health care support when they're unable to access an appointment. Those statistics are both concerning and startling to see that families are turning more and more towards the emergency room. For half of the folks that had used the emergency room for mental health care support in the last 2 years, 50% had done so multiple times. And it goes to the healthcare access and mental health care access specifically data that we see in the report. But when we think about military spouses and the weight that they're carrying across that invisible load score and compare that to their need for mental health support and the suicidal ideation, it paints a really clear picture about the need to address their well-being.
Did the same issue come up in the 2023 survey?
We did not see that trend in the 2023 survey, no.
I also wanted to zero in on food insecurity because something that really stood out to me from the report is that in 2025, around 40% of respondents said that they were experiencing low or very low food insecurity. And that is up from 15.6% across the full population. So that was in 2023. We went from 15% to 41%. Also, you write in the report that many respondents said that they're skipping meals or portions of meals so that other family members can eat. How do you explain such a spike?
So our survey was fielded from October to January of that 25 to 2026 New Year season, which coincided with a government shutdown and emergency response support from MFAN. Nevertheless, when we look at our food security numbers, we see an upward trend, but we see that in many other areas of the financial security section of the report broadly. We see that in financial well-being. We see it in housing burden. We see it in emergency savings, those who have experienced a financial emergency in the past 2 years. And so the trend is certainly growing, that families are having a more and more difficult time with finances, of which food insecurity is one symptom. When we looked at the Milburn Institute Financial Wellbeing Scale this year, we saw that about 40% of families are just getting by with their finances. And we see this, again, across many areas. But when we think about food insecurity, for the first time this year, rising grocery prices was a key driver to families being unable to afford balanced meals. This picture grows more and more concerning when we think about the fact that military families, many of whom do not have emergency savings or have less than $500 in emergency savings, also frequently experience financial emergencies. About 50% had experienced a financial emergency in the past 2 years. And so these compounding financial challenges and strains ultimately show up in food insecurity and other financial hardship.
That's Dr. Gabby L'Esperance, Military Family Advisory Network's Vice President of Research and Evaluation, speaking with Federal News Network's Anastasia Obis. You can find the story at federalnewsnetwork.com.